basically what I saw, especially in 2020, was just a complete failure of the public health apparatus in the United States and in my state of California and in my city of Los Angeles to really address root causes and to look at downstream consequences of all interventions. Scott Atlas, I remember very early on, within a few months of the pandemic, was talking about his analysis of the disability adjusted life years and quality adjusted life years with lockdowns and kind of these uh, draconian interventions and how long term it was going to actually cost. And again, this is something I learned in public health school: quality adjusted life years, disability adjusted life years. How these which is basically applying an economic uh, factor and assigning a number to a certain lack of quality in one's life or a certain disability in one's life. So if you, for example, take away a certain number of years of education for a person, economists have kind of figured out that that ultimately is going to affect their ability to make money. And we actually have realized that it actually causes a reduction in mortality, and so, or excuse me, an increase in mortality. So you theoretically die earlier. And so then what happens if you've locked a child down from school? Then that ultimately is going to reduce their economic viability and it's going to increase their mortality risk. So again, this is something I learned in public health school, that it's important to think about these things and the downstream effects of every intervention you make. And there's a wisdom. And we also learned this in medical school, Randy, right? Sometimes the wisest thing to do is to do nothing for the patient. Even if the patient wants you to do something for them, you can write down in the chart, patient, says they're going to leave my practice because I'm not giving them X, Y, and Z. I've explained, the risk, benefits, and alternatives doing X, Y, and Z, and I've explained that I'm not going to do that for them. And and so you end up having patients go doctor shopping, which is a problem. But the ultimate idea for me is to like have a wisdom about when should we intervene, how we should intervene, what are the consequences, the long-term consequences of intervening. Lockdowns, masking a 1-year old or two, excuse me, masking a 2-year old, vaccinating a child under an emergency use authorization. Like, what are the downstream consequences? I was flabbergasted some of my physician colleagues weren't doing these things. They just weren't. And I was flabbergasted that the public health apparatus and our government wasn't thinking of these things.